Okay, good morning, everyone. I'd like to call the November 8th Finance Committee meeting to order. Can we have a roll call, please?
Member Chaplin.
Here.
Member Covert. Member Desart. Member DeCiani. Member Eckhoff. Member Garcia. Here. Member Hart. Member Krajewski. Member LaPlante. Member Ozog. Member Phillips. Member Pachalski. Member Renahan. Member Rutledge. Member Schwarzy. Member Selman. Member Tonatore. And Member Zay.
Great, we have a quorum. So this morning we have our presentation from our health department. So I'd like to call Karen Ayala up. Morning, Karen, welcome.
Ooh. Thank you so much for the privilege and honor to provide an overview of the DuPage County Health Department budget and strategic investments planned for this coming year. It is absolutely incredible that another year has passed and we're at this stage again. We have seen a significant but not a complete contraction of our COVID-19 response work, but on kind of in line with that, we've added monkeypox, Ebola, and are now challenged with the RSV virus. And yet that work reflects only a sliver of the work supported by the DuPage County Health Department to address the mission of our organization, which is, as a reminder, to promote physical and emotional health, to prevent illness, injury, and disability, and to protect health from environmental risks, while assuring accessible, quality, and effective services. So as the representative for the staff and members of the DuPage County Health Department Board of Health, I am pleased to present an overview of the FY 2023 budget, which includes a request for level funding of $18.650 million from the public health levy. Okay, so I have actually two financial slides to share with you this morning, because I like to think that I have learned from you as you have hopefully learned from me. Less is more. On this first slide, incorporates all three funds held at the health department. It includes $50 million in grant applications to accommodate any large-scale emergency response public health efforts, and the next year's estimated support through ARPA funds budgeted based on the actual spending trends from this year. Both of those combined add approximately $58 million to the budget in both revenue and expenses. And the results demonstrate a nearly flat, balanced budget picture of $113,613,597. I'd like to offer 6 key takeaway points based on this slide. First, when addressing revenue projections, we see significant positive trends with our patient and client care billing effort. That actually is increased by $3.275 million. And that's a result of increased reimbursement rates for services such as dental, immunizations, substance use disorder treatment, and mental health services. In addition, our collection rates have improved as our staff have become more veteran and skilled in medical billing and contracting with Medicaid managed care companies. Secondly, our investment income is estimated to increase with the financial markets raising rates. A note that we do not need to use or rely on fund balance this year to balance our budget. Now on the expense side, our personnel costs are rising, but the increase or decrease in IMRF rates provided us somewhat with some much needed relief. Inflationary pressures are clearly planned for and seen in the increased costs of our commodities. And with increased demand for more services offered throughout the county and across all of our service areas, but most importantly and critically in behavioral health, our capital investment costs reflects the need to update our client-facing space. In fact, you see 28 additional FTEs being budgeted in this proposal. 21 of those are for direct service behavioral health staff. We simply do not have the room at our existing facilities with the current floor plans to accommodate those individuals. However, what I also wanted to provide for you is the actual, what we consider our operating budget, because our ARPA and our grant application dollars really operate outside of our operations budget. Our operations budgets reflect an increase that's slightly larger when you strip out the $58 million of potential income. You see an increase of 7.5%. So the key trends that I mentioned in this budget remain, or in this perspective remain. But I'd like to make a couple of other observations from this slide as well. We are anticipating nearly $500,000 in the budget as a result of new and increased public health grants funds. From an expense side, our ongoing public health personnel budget will increase just over 6%. We too have been significantly challenged by workforce shortages across multiple areas of the health department. We have again provided for merit-based increases in our proposal this year. So what does this budget provide? It provides continued support to over 4,000, among other things, food service establishments. It provides ongoing maternal child health programs and support to some of our community's most vulnerable families. It provides oral health services available now in both Wheaton and Lombard, in addition to the Smile Squad. It provides an opportunity to continue our coordination and our facilitation of community initiatives to address high priority health concerns, such as early childhood needs, impact DuPage to continue addressing and identifying the high priority healthcare needs. Our heart work, the health equity and access response team to address health disparities that exist, to address teen substance use and mental health concerns. It also provides for ongoing communicable disease and epidemiology for both the communicable diseases that we're most familiar with clearly over the last 3 years, but also expanding to more chronic diseases, being able to take a deeper dive and a preventive lens in addressing those in our issues in our community. It provides for disease control services and treatment for issues such as tuberculosis, STDs, and HIV in our community. And of course, it provides for expanded mental health and substance use treatment services. Over the past several years, we have been working with the state of Illinois to both create and further mature our crisis behavioral health system of care. This year, we transitioned our existing 10-digit crisis line available 24/7, 365 days a year to the 988 system. That occurred in July of this year on July 16th. Our mobile crisis response teams have expanded with additional financial support from the state. And as I mentioned, the reimbursement rates for many of the mental health services being provided at the health department have increased substantially. And although we enjoy more behavioral health services than other areas of the state and more robust systems than across many areas of the country, we hear from different members, but in every single community, we still have more to do. And when I say we, I want to make sure it's clear. We as the DuPage County Health Department have more to do, and we have more to do to expand the capacity for the entire system of care across our county. So let's take a look quickly at the different components of an ideal behavioral health crisis system. And why we address this crisis system is because this is the way most individuals will seek and receive treatment throughout this chronic and episodic course of a disease, whether that be substance use or chronic mental health services. People don't wake up in the morning when things are going really well and say, oh yeah, I need to get back to treatment because things are going well and I don't want it to end, right? They wake up when they're in crisis and have a very compelling need. So first, the idea that it is a system is worth note. A system does not have to operate all under one roof, or all services need to be provided by specific limited entities. But a system implies that the programs and services are coordinated, standardized, and duplicated. Bottom line for building a behavioral health crisis system is the goal is that every person receives the right service in the right place every time. Individuals in crisis currently have two general ways for receiving care and attention when in crisis. They either go to busy emergency rooms through an interaction with the criminal justice system. Our work through the health department's behavioral health collaborative since 2012 has been designed to create more effective, responsive, and humane pathways and systems of care. So as we chart our course and our progress across this graph, on the far left side, you'll see the someone to call. Again, this service has been available for decades in DuPage County and fields thousands of calls a month. Now individuals don't need to remember that 630-627-1700 number. They simply dial 988. We have seen a slight increase, but not significant increase in those number of calls. And that, frankly, is probably because people already knew we existed and they were calling us in the first place. Then we look at someone to respond. We have expanded our mobile crisis response teams to be able to move from pilots with 3 communities across the county to allowing the work to expand to all communities. Additionally, we partnered with CDH, the Emergency Medical Services Director, and received a waiver allowing EMS to transport directly to our crisis respite stabilization unit versus the emergency room for people who meet the eligibility for that program. Finally, and kind of to that point, it's the somewhere to go. Our 12-bed crisis stabilization, fully voluntary unit allows for a safe place to go with psychiatric services, nursing, and psychosocial support for that 5 to 7 days that it may take someone to kind of get back on track if they're seeing an escalation of symptoms, or to transition back to home after being in a more controlled hospital setting. Finally, linkage to community providers. We are the safety net providers, but we enjoy robust partnerships with many behavioral health providers across the community. Let me talk a little bit about the expansion of the Central Receiving Center. I talked about the Crisis Respite Stabilization Center. I think in the physical health world, that's like a physical rehabilitation place where you go and you're able to begin meeting your needs of daily living. You're able to get up and down safely out of a chair. That is not meant to be a long-term placement, but it's meant to be a place to land until you have the skills necessary for being successful at home. That's the Crisis Respite and Stabilization Unit. Central Receiving Center, on the other hand, is a model. It is not a new concept or a new model. We have been working on this particular model with community partners since 2017. But in this upcoming fiscal year, we are ready to pivot from thoughts and philosophy into action. Now, there are, and when we talk about what is this model, it's when someone you care about needs help because they're experiencing a mental health or substance use crisis. The CRC provides, this model provides a safe, caring, and medically appropriate alternative to an emergency room or jail. I don't know if you've had the opportunity to sit with a family member or a friend in a busy emergency room if they're having a behavioral health crisis, but based on the way the emergency room triages their standard of care, you can be sitting there for quite some time because, again, it is not one of the things that emergency rooms are designed to do. And so this provides a way of addressing those needs in a different manner. Now, there are multiple goals associated for this model. And I look forward to coming back and having a more comprehensive overview after the new calendar year, but wanted to point out a couple of key points. This provides a single point of access. The Central Receiving Center provides a single point of access for law enforcement officers or EMS or family members or for individuals to walk in who need help. It provides a safe alternative to some of the other current pathways that we see providing mental health support. We anticipate being able to appropriately detox or transport individuals who are experiencing acute withdrawal from a substance use disorder to an emergency room. We anticipate that this will reduce the inappropriate utilization of emergency departments and again, provide an effective and efficient use of existing resources. Central Receiving Center offers a 24/7 crisis intervention access with assessment and evaluation. It provides, instead of, again, to the emergency room example, if you've been there at the end of your visit, if the person that you're with or a person seeking care does not meet the need for inpatient hospitalization, in essence, they're given a list of these are places to call, good luck, and hope it goes well. This center would provide the warm handoff through a well-established linkage and relationships with next step providers. Would also provide some of the other elements that lead to an exacerbation of symptoms, including food insecurity, job placement, other community resources, and again, that sobering detox linkage for substance use treatment. Now, who benefits from the CRC? I think a good idea is one that is a win-win situation, right? Well, we can all agree. The Central Receiving Center model is one that exponentially benefits that win-win scenario for our communities. We see that the individuals in crisis themselves will benefit. Law enforcement will benefit. EMS service providers will benefit. Hospital systems will benefit, and the community as a whole will have an opportunity and a resource so that we can confidently say to our entire community that if you are in need of immediate mental health or substance use intervention, you can come here. So again, I look forward to providing you with more information on the CRC model because we are in the field digging the rows and cultivating the soil for this. And I look forward to bringing you updates.
Great. Thank you so much, Karen. Do we have any questions from any of the board members? Member Garcia and then Member Krajewski.
Yeah, thanks, Karen. And I'm so excited to see this come forward. You know, I've been a proponent of this plan for a long time. You know, I actually know someone in my community who's been a friend whose daughter did have a mental health crisis and did end up in the correctional center. And it was a horrible experience for the whole family. So this is something that is so well needed in this community. And I look so forward to, you know, I'm the one who bothers you for a long time. How's it going? How's it going? So I'm hoping that we can get this forward sooner than later. I'm excited to see it coming before us today. So, and I thank you for all your hard work on this. Thanks.
Thank you, Member Garcia. Member Krajewski.
Thank you. Thank you, Karen, for the presentation. I know you said the budget was up 6.5%. The 28 head count, it was
Yes.
like 2.7 million plus like 600,000 contractual services. That was offset the revenue. It was called patient client care.
Patient client care is our Medicaid billing.
Okay, so it almost looked like, I mean, Medicaid is the 3 point whatever million is covering the entire cost of our.
It is.
And so the question being, I mean, I wouldn't really say we got a 7% increase. We just, our revenue's coming in and we got the same expenses. Is the fact that we could hire a few more people, is it the same effect as if you get 4 more people? Does that mean our patient care revenue goes up another corresponding?
Absolutely. And I think that's a very key point, that the behavioral health services staff not only provide a valuable service, but all of the services they provide are billable.
Right.
And so exponentially, we can continue to increase.
So it seems like, you know, it's a no-brainer to even have more people, just making sure we have the capacity. And like you said, you don't maybe not necessarily have the space where you're currently at, but I think long-term looking at a plan to make sure, you know, we can bring, because it's not really costing us that much because we're billing most of their time.
Correct.
Even if it costs us, you know, 10 or 12, 15 grand per employee, I think that's worth it to bring even more help on board. But you don't want to get too big where you can't handle capacity. Absolutely.
And to that end, if you know of someone who's interested in a community mental health opportunity, please send them our way, because mental health professionals are a bit of unicorns right now, because there's so much realization that their skills are highly needed across communities. So we are working with not only you know, hiring people through the traditional route, but developing pipelines from universities and developing internships and apprenticeships, which typically doesn't happen in this field, but anything to give us an edge is something that we're looking at.
Sure. Well, I would even look at, you know, giving a little more money to recruit them there. Even if your Medicare building is a little less than what we pay them, at least, you know, you're able to.
Absolutely.
So, okay. I would continue to maybe look at exploring even more help. Thank you.
Thank you, Member Krajewski. I have Member Eckhoff.
We've got a couple of 708 boards that already exist in DuPage County, and we've got a couple more that are on the ballot today. And I'm assuming those are going to pass. And I don't have a problem with, I think 708 boards are good. And I don't mind the townships being involved in them, in additional taxpayer money for mental health. My concern is that we're going to have 9 township boards with 9 people on it each. It's about 81 people. We're going to have 9 sets of administrators, 1 for each township. And I'm trying to figure out how DuPage County, our health department, can coordinate with the townships and reduce the amount of overhead administration and the cost, because I'm being told it's $50,000 per township, so that money can go help the mentally ill as opposed to funding more administrations.
Right. I think our primary concern, and I share that concern, our primary concern from a county-wide service provider of many of these types of programs is that there's going to be 9 different sets of eligibility for individuals who reside in that township. And is it going to be if you reside or go to school in that township? And then how are we going to manage those kinds of things? So I think that our focus initially initially will be on working with our township 708 boards to figure out, is there like a baseline set of services that we could all agree upon if in providing funding for, and then building out those systems. Because again, otherwise you have groups of programs, you don't have a mental health system or a substance use system. It's confusing, it's frustrating, and it's burdensome on the community mental health provider, not only us, but others who provide countywide services, to track and figure out, okay, now I have to make 9 different applications for these services. I have to add people who can determine eligibility, that kind of thing. So I absolutely agree. Who can argue with more support for substance use, mental health services across our community? But I think our challenge will be, let's create a system of care so that we don't have some of the challenges that exist in surrounding areas.
So are we gonna reach out to them to do that?
We are.
And I had one other question.
Of course, Grant, Member Eckhoff, we will use our influence and our powers of persuasion, because from an authority perspective, we have no authority over their processes,
Right.
but we will do what we can.
My whole idea was to show them a way to do it more efficiently, so we save money and we can use that money to help more people.
I agree.
So, regarding the 988
Mhm.
phone calls, where do those calls get routed?
They get routed to our crisis phone lines. We have people sitting over in the Kerswa Community Center where we have had people sitting. And prior to that, it was in Lombard. 24/7, they pick up the phone. We're part of the National Suicide Hotline. We also have a crisis mental health line that we've been, so the 988 is really the National Suicide Hotline number that's transitioned.
So DuCom and ACDC don't get involved?
No,
It just, I mean, I'm glad we have a separate number for that, but we've got 988, 911, 311, 211, and I'm getting a little concerned that there's too many emergency numbers out there and people are gonna be confused and need a list by your telephone. of all
Right,
the different
right.
numbers.
now there is planning underway that the 988 system, right now, it's completely separate from 911. But in the upcoming year or two, there's plans to incorporate that and integrate it into the 911 system so that 911 responders could send those calls instead of sending out a police EMS dispatch, that they would refer to a mental health dispatch.
Thank you.
Thank you, Member Eckhoff. I have Member Garcia, Member Pachowski, and then Member Rutledge. So Member Garcia.
Yeah, thank you again. I forgot to mention this, and maybe this is more a question for staff. I know I had brought this up at the last meeting. We've just got the latest allocation of ARPA funds, and I want to make sure that we've got this earmarked, because I know that we had some discussion that there's going to be a couple of $1 million that we're going to need for this central receiving center. And I want to make sure that we've got that earmarked in our ARPA funds, because this is actually one of the tenets of the ARPA funds to help people with mental health. So I don't know if that's something that I need to bring before the finance chair, or how do I do that to make sure that we can get some kind of earmarks for this? Because I want to make sure that this is paid, this is able to be paid. I know we got a $5 million grant, and I think we got another grant from that. And I just wanted to make sure that we have enough from our ARPA funds.
So there are remaining funds in the ARPA account, enough for this. I will say that, I know we've been talking, there are excess funds available also at that were originally allocated to the health department that can be reallocated, but that won't cover the entire amount, but there are sufficient funds. It has not been brought before this board for consideration, so nothing has been officially earmarked.
Okay.
But I know that when Karen comes forward, beginning of 23, there will likely be an overall funding discussion at that point where the funding would come from, but there are sources available.
And you don't see an issue with this not having enough allocated, or ARPA funds still not being allocated everywhere else? I just want to make sure that there's some kind of an earmark.
I mean, ultimately, it's the decision of the board. I mean,
Right.
if between now and then the board decides to pursue another path, yes, there could be a problem, but as of right now, there is not a problem.
All right, thank you, Nick.
Thank you, Member Garcia. Member Pachowski.
You had one of your slides saying Medicaid rates were being increased. Is that going to be a positive or negative for us? Because I'm just curious as whether you see that as, is that facilities now going to take more Medicaid cases? I do see that helping or benefiting, or is it going to be more of a detriment in other facilities starting to take these applications?
Well, the good news is there's plenty of work for everyone, and there are so few Medicaid providers currently available in the community that we're hoping it encourages people. Now, the rates are only one challenge for providers. The avalanche of administrative burdens and responsibilities to provide Medicaid reimbursable services, as you guys know from the care center as well, sometimes crush the will of providers, but it's definitely a positive for us. And we're also hoping that it opens more doors in the community.
Because I was hoping with more Medicaid facilities is better. It's good, not bad. So that's my point.
Absolutely. Absolutely.
Thank you, Member Chowski. Member Rutledge.
Thank you, Chair Chaplin, and Karen, thank you for coming this morning. It's always good to see you and hear what you're doing. So my question is, Bloomingdale Township, and I'm not sure if the others have had their 708 board in place for a while. So based on your comments about coordinating those townships, what's working, what's not, I guess is my question there.
So some of it's still, although they've been around for several years, it's still very new in the process and developing the process. One of the programs that we did in partnership with Bloomingdale Township 708 was actually, we weren't a funded entity, but the 708 board funded Roselle Police to have a crisis mental health counselor available, and Roselle contracted with us initially for this service. So we're operating in that space. Everybody's getting their feet underneath them and really working to make sure that, you know, we start out small with I believe we start out small with a request from taxpayers, make sure that the models are set and then expand. So very new, but we have a little bit of experience.
Great. Thank you, Member Rutledge. Member Hart.
Thank you, Chair Chaplin. Karen, thanks again for all your leadership and coming here today and going through your budget. I had a quick question. I know we discussed this at the last Hope Task Force meeting, but the opioid distributor lawsuit funds that are anticipated to come to the county, I know it was around 10 to 10.5 million over 18 years. Do we have any update on when the first disbursement from that lawsuit will come?
Well, our understanding is that it will be coming in the next month or two. We actually have a call, Nick and Jeff and State's Attorney Berlin and I tomorrow to discuss then from that point, because I think to your question, that's an opportunity, you know, Paula, with your question about the ARPA and the dollars that we have available now for potentially building or renovating a facility, that's one funding stream that we need to get set, but ongoingly, we need to make sure that the central receiving center has sufficient income. And so certainly the opioid resettlement dollars would be a potential for that. I would like to offer an idea of potentially we could use some of the cannabis tax revenue as a measure of support to address mental health and substance use needs in the community. We've been meeting with some of the criminal justice leaders. We met with DuPage managers this past week to really set the stage that this will not be something that's opening as a program and then 3 years from now it's too bad, so sad, we can't continue. No, this is going to be in perpetuity for our community members.
Wonderful. Thank you.
Great. Thank you, Member Hart. Member Renahan.
Thank you. Thank you, Karen, for coming in today. Not being on the health department board, to me, it's a little amorphous what this means, the central receiving desk. Are we talking about, you just said a facility. Are you talking about building or actually having a place you can go to?
Yes, yes.
Okay, all right, because I mean, 12 beds is just not cutting.
No, the 12 beds is not, that's not like an emergency, that's like a respite center. What we're talking about is having a facility that operates like an emergency room.
Okay, all right, that helps a lot.
Yeah,
Thank you.
sorry.
Okay, well, great. Karen, thank you so much
Thank
for
you.
coming before the committee. Thank you and your staff for all the work they do. You know, we see the mobile unit out at so many events doing good work in the community. You know, the work through the pandemic, the work that you guys continue to do is so much appreciated. So thank you
Thank
very
you.
much.
Thank you for all your support.
Hey, thank you. So with that, we move on to public comment. Do we have any public comment this morning? No public comment. Okay, I have no chair remarks. Can I have a motion on approval of minutes from the October 25th Finance Committee meeting? I had a motion by member Krajewski, second by member Schwarzy. Any discussion? All those in favor? Opposed? The motion carries. Can I have a motion on FIR 047022 budget transfers 11-8-22 from various companies and accounting units? Motion by member Schwarzy, second by member Salmon. Any discussion? All in favor? Opposed? The motion carries. We move on to item number 8, procurement requisitions. Member Krajewski for finance.
Thank you, Madam Chair. I move on a change order amendment to purchase order 5835-001 issued to ODP. Purchase order in the amount of $14,000 cover office supplies.
Motion by member Krajewski, second by member Garcia. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIP 0314-22, recommendation for the approval of a contract purchase order to Mesero Insurance Services to provide property insurance for all county properties, including the health department. $358,281.
Motion by member Krajewski, second by member Salmon. And any discussion? So I see lots of discussion on this. So I have member Salmon, Chowski, Zay, and Desart. Member Salmon, go ahead.
Thank you. And this, I don't know if this is more for procurement or stormwater. I'm just curious how our rates compare to prior years. I know there's been a lot of disruption in the private homeowner and flood insurance industry, and there was a massive change last year. I'm wondering if that's also the case for, I don't know if this is commercial, I guess, and I'm hoping we're saving some money.
As far as our flood insurance, we are covered. And overall, through all of our policies, we only saw a 6 to 8% increase. So any flooding throughout the county did not have a substantial effect on our rates at all.
Is this separate from the FEMA program then?
This is separate, our separate property casualty workers comp. It's all kind of packaged.
Okay.
Yeah, that would be separate. to answer your
Okay, I was,
question.
because I know the FEMA rates, they redid it and it dropped a lot. So I was hoping we were saving a little there.
This would cover flooding throughout the county campus. It's my understanding that we're in a flood zone here, so we did pretty well.
Yeah. Okay, cool. Thank you.
Thank you, member Salmon. Member Pachelski.
You know, you said everything was 6 to 8, but this was a 13.6% on this one. I was curious. And I was the reason it said further increases in insured value. Is that the basis for the difference? And what does that mean, by the way?
With all the construction going on,
Why don't you just call it new construction? I don't know. I mean, you know, further increases in insured value tells me nothing. And I'd like, if that's what it is, and I understand the difference between a 6% and 13.6% raise. It's just that the language used here, I had no clue what it was based on, but you're saying that difference is all new construction.
all new construction, all the buildings that are going, and they're taking into account future years too, because they know what's going on.
Thank you, member Pachelski. Member Zay.
Thank you, Madam Chair. I think it's like for the third or fourth year in a row. This company's not called Mesero anymore. They're Alliant. Why do we keep
Alliant.
using the old name? I mean, I don't understand. I mean, it should be the right name of the insurance provider.
Yeah, okay, we'll update that. It's
Okay, well, I've been saying it for like 3 years.
alignment.
So, you know,
we
I
missed
mean,
that.
at some point, you know, it says Alliant Insurance Services, formerly Mesero, you know, on the executive summary. So, you know, I've been hanging around Dawn too much. You know, I've been reading a lot of stuff and, you know,
We'll make sure the purchase order is
okay,
correct.
thank you.
Go ahead. You want to go ahead and address that?
No.
Okay, member Desart.
Thank you, Madam Chair. A lot of my questions were answered by my colleagues, or asked and answered when my colleagues asked them, but do we, wait, no, we do a lot of business with Align, but do we go out to bid on these things?
In fact, Patrick Genovese, our risk manager, handles the RFP for our brokerage services with property and workers' comp. When's the last time we went out to bid, Patrick?
We got our insurance carriers responses on November the 1st. Property insurance was 1, 2, 3, 4, 5, 6, 7, 8, 9 carriers. Went out. Excess liability is 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18 different carriers. So a total of 40 different insurance carriers were approached by Alliant Mesero to bid on our insurance.
Thank you. Thank you.
Thank you. Thank you. Member Krajewski?
Yeah, I think the bigger question is, when's the last time we went out to bid on the broker? The broker just went out and got 11 quotes from 11 companies. He could have got quotes from 50 companies. The question is.
The broker is under a 3-year contract.
Okay, so the
This is the last year for the 3-year contract.
And how many times have we used that?
This is the second time
Okay,
of the 3-year contract, of a 3-year contract with a 1-year option for renewal.
my suggestion when we go out to bid is, the brokers have contracts pretty much with everybody, especially the big ones, right? They have contracts with pretty much every insurance company out there. And, you can't have 2 different brokers go after companies because the first one that gets into the insurance carrier is the other ones are prohibited from going. So what you may do is, ask 2 or 3 or 4 of the bidders to give them their top preferred insurance carriers that they would use.
Yes.
And then use that in your bid, because they can all use all the same carriers. I mean, ABC company can get the same companies here that Mesero has.
For the most part, you're correct. And we do ask other brokers to respond on the RFP.
Right, and you just say, and then I would pick your final 2 and then have them each give you a list of their carriers that they would go to. Because that'll be the best competitive process.
I agree.
Great. Thank you, Member Krajewski. Any other questions? Okay, all in favor? Opposed? The motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIP 0315-22, recommendation for contract purchase order to Mesero Insurance, formerly Mesero Insurance, to provide our work comp insurance to the county and the health department.
Motion by Member Krajewski, second by Member Desart. Any discussion? All in favor? Opposed? The motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIP 0316-22, recommendation for the contract purchase order to Mesero Insurance Services, Inc. to provide our employment practice liability insurance.
Motion by Member Krajewski, second by Member Desart. Any discussion? All in favor? Opposed? The motion carries. Member Krajewski?
Thank you, Madam Chair. And last, I move on FIP 0317-22, recommendation for the approval of a contract purchase order to Mesero Insurance Services.
Motion by Member Krajewski, second by Member Desart. Any discussion? All in favor? Opposed? The motion carries. Thank you, Member Krajewski. We move on to Health and Human Services. Member Renahan.
Thank you, Madam Chair. I move on HHSP 304-22, recommendation for approval of a contract purchase order to Home Depot USA to furnish and deliver housekeeping supplies and cleaning chemicals for the care center, November 8th, 2022 through October 31st, 2025, not to exceed $189,000.
Motion by Member Renahan, second by Member Selman. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Renahan.
I move approval of HHSP 305-22, recommendation for approval of contract to WSP USA Design to provide professional architectural and engineering design services for the care center on November 9th, 2022 through December 31st, 2026, not to exceed $1,806,300.
Motion by Member Renahan, second by Member Desart. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Renahan.
I move approval of HHSP 306-22, recommendation for approval of contract to White Construction Services to provide construction manager at risk guaranteed maximum price method of delivery for the modernization and upgrades of the care center, November 9th, 2022 through December 31st, 2026, not to exceed $29,693,700.
Motion by Member Renahan, second by Member Garcia. Any discussion? Oh, Member Zay, go ahead.
Thank you, Madam Chair. What kind of pricing safeguards do we have in this contract? With obviously supply chain and all of this, I mean, We don't want to be approving 29 million and in 3 weeks it's 38 million. I mean, what kind of safeguards do we have on this?
Thanks. I don't come up with that much, sorry. Because of the duration on here, what we've identified in there is the work that we want to do. And right now, we've reviewed that, we've analyzed that. That's kind of the art of the negotiations move ahead. We might have to add a little scope, but that's common on projects review that are 3 months, 12 months, 40 months.
Okay. So we don't.
It is a guaranteed maximum price. Everything that identified in there is what's going to be built.
Okay. Thank you.
Thank you, Member Zay. Member Pachowski.
We're doing the north. We're doing the north, east and south, but there's nothing, it all looks like it's all cosmetics. We're patching, we're painting, we're not besting out walls and changing. The existing floor plan is going to be existing floor plan. All we're doing is modernizing, repainting and flooring it. Is that a correct statement?
We're also doing the exterior. We're also redoing the entrance. But no, the majority of the walls are going to remain in place, correct?
Okay, now we always had one section that was vacant for many years. What section is that?
That's the south end. The first floor is occupied by primarily administration. 2, 3, and 4 are vacant.
Are we doing that whole area? Because for years I said, why do we have a facility that is that huge, that's been vacant for years, that we don't have it to some use? But the unit, the facility I'm talking about is the south unit, which is now being renovated for some use by the care center. Is that a correct statement?
We're not doing 2, 3, and 4 on the south wing. That is not a part of this project.
So we're just doing the main floor?
Correct. We're doing about 40% of the work is in the north wing. And then it's divided up into the other wings accordingly. And the north wing will be, if you approve this contract, will be bid in the street probably within about 2 weeks.
Not that it has anything to do with this contract. What's your thoughts of what we do with those other floors on the south that have been vacant for many, many years? I mean, eventually got to do something. Down the line, is there some plan? Either we knock it out or do something, but it seems to me to have it sitting empty for so many years, it's a deterioration.
So you're spot on that. The fact that it has not been used for the number of years. I mean, there is a significant expense. We've looked at that for renovating and we've looked at different options. I don't anywhere from having like a nursing training area to expanding the beds. But I think our last estimate was between 11 and 13 million for that wing. I mean, clearly it has a function. We have to find the right function and right fit, but that would be an additional expense by whatever function does come in there.
Right now, all we're doing is the main floor for about 2.1 million.
I mean, so this project right here has the main floor, and all of the vast majority of the rooms for the residents are all being rehabbed as part of this. That one wing is not being used for anything right now. It's just storage
Except for the
various
main floor.
apartments.
That's the 2 point.
The main floor is obviously the coming into the building, and the main floor is being rehabbed, but the south wing going up isn't being touched, but the other wings are being touched.
We have nothing in the books or no plans or anything for future use. It's going to sit until some board decides to do something with this.
We need to, I mean, we've looked at different type of clinic things, partnering with the health department, mental health. We looked at we have to find the right function would fit, and obviously come before this board to present that to you for consideration.
It'd be nice if we could get that finally in some type of use, but thank you for the.
Thank you, Member Pachowski. Member Garcia.
I was just gonna ask, is the south wing being used during this construction for using it for storage for items and things? And so is that being helpful right now for this?
So the south wing right now is being used for storage. A lot of departments store because you've got different rooms. So we do use it for storage right now. As far as functionality during the construction process, I mean, it might be used a little bit, but I don't think there's a need for it during construction. We definitely can't transfer patients or have any kind of utilization by the care center.
No, I was thinking more construction, like, items and things like that.
Potentially it could be.
Okay, thank you.
Thank you, Member Garcia. Member Krajewski, did you have a question?
You know what, I do, but I'll get it asked later and my information. Thanks.
Okay, thank you. Any other questions? Okay, all those in favor? Opposed? The motion carries. We move on to judicial public safety. Member Renahan.
Thank you, Madam Chair. I move approval of JPSP 29722. Recommendation for approval for contract purchase order to Global Public Safety Jail Tracker for a jail management system for the sheriff, not to exceed 570,000.
Motion by member Renahan, second by member Garcia. Any discussion? Member Desart.
Thank you. I just wanted to know, was this in the 2022 budget? Do we have anyone from the sheriff on the line? Oh, Nick, this C #1, the jail management system for the sheriff's office, was that in the 2022 budget? Okay, well, maybe for county board, I just want to know if this is something that popped up or is it? Was it in the actual budget thing?
They can provide more depth, but this absolutely did not pop up. This was planned. This has been planned. So, it has been planned for some time, I think, because I know they've been talking about it for the better part of a year.
Okay, thank you, member Desart. Any other discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Renahan.
I move approval of JPSP 29822, recommendation for approval of contract purchase order to Streichers Inc. for new ballistic and stab vests for the sheriff, December 1st, 2022 through November 30th, 2023, not to exceed 165,000.
Motion by member Renahan, second by member Garcia. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Renahan.
Move approval of JPSP 299-22, recommendation for approval of contract with CDW government for new audio visual equipment, replacing old and aging failing equipment for the Office of Homeland Security Management, Emergency Management, November 8th, 2022 through November 7th, 2023. Contract total of $81,704.11.
Motion by member Renahan, second by member Garcia. Any discussion? Okay, all those in favor?
Aye.
Opposed? The motion carries. Thank you, member Renahan. We move on to Public Works, member Ozog.
Thank you, Madam Chair. I move for approval of FMP 030122. Recommendation for the approval of a contract issued to Home Depot doing business as Home Depot Pro to furnish and deliver housekeeping supplies and cleaning chemicals as needed for the county campus for facilities management for the period November 9th, 2022 through October 31st, 2025 for a total contract amount not to exceed $90,000, Intergovernmental Cooperation Act.
Motion by member Ozog, second by member Garcia, or member Selman. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Ozog.
Thank you. I move for approval of FMP 030222. Recommendation for the approval of a contract to Valdez Supply to furnish and deliver restroom tissue and bath and paper towels to the Judicial Office Facility, JTK Administration Building, and the jail on a monthly basis and as needed for the power plant, Children's Center, Office of Emergency Management, and the Coroner's Office for facilities management for the period December 1st, 2022 through November 30th, 2023 for a total contract amount not to exceed $131,061.70 for lowest responsible bid.
Motion by member Ozog, second by member Rutledge. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Thank you, member Ozog. We move on to stormwater. Member Zay.
Thank you, Madam Chair. I move on SMP 30322, approval of contract issued as Tech Systems for asset management software for Stormwater Public Works Division Transportation, the amount of $209,380.
Motion by member Zay, second by member Pachowski. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Zay.
Thank you, Madam Chair. I move on SMP 30722, a contract issued to Earthworks Land Development for on-call construction services in the amount of $2,222,744,000 per lowest responsible bid.
Motion by member Zay, second by member Desart. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Zay.
Thank you, Madam Chair, I move on SMP 30922, here between DuPage County and V3 companies for professional engineering services in the amount of $91,788.80.
Motion by member Zay, second by member Selman. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Zay.
Thank you, Madam Chair, I move on SMP 31022, an agreement between DuPage County and SumCon Professional Engineering Services amount not to exceed $95,000.
Motion by member Zay, second by member Garcia. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Zay.
Madam Chair, I move on SMP 31122 into a joint funding agreement between DuPage County, United States Department of Interior for period of December 1st through November 30th, USGS, the amount of $367,000.
Motion by member Zay, second by member Garcia. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Zay.
Thank you, Madam Chair. I move on SMR 45422 intergovernmental agreement between DuPage County and the city of Warrenville, the amount of $353,500. ARPA item.
Motion by member Zay, second by member Desart. Any discussion? All those in favor? Opposed? The motion carries. Member Zay.
Madam Chair, I move on SMR 45522 intergovernmental agreement between the county of DuPage and the city of Wheaton for Cadillac and Wakeman flood improvement amount of $500,000 ARPA item.
Motion by member Zay, second by member Desart. Any discussion? All in favor? Opposed? The motion carries. Member Zay.
Madam Chair, I move on SMR 456-22 intergovernmental agreement between the county of DuPage and Downers Grove Township Highway Department for Wood Creek Culvert Project, amount not to exceed $236,100.
Motion by member Zay, second by member Desart. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Zay.
Thank you, Madam Chair, I move on SMR 45722 intergovernmental agreement to the county of DuPage and Milton Township Highway Department for Valley Road Culvert Project, amount of $295,000 ARPA item.
Motion by member Zay, second by member Desart. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Zay.
Thank you, Madam Chair, I move on SMR 45822 intergovernmental agreement between the county of DuPage and Bloomingdale Township for Maple Avenue Culvert Project on $126,224.
Motion by member Zay, second by member Desart. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Zay.
Madam Chair, move on SMR 45922 intergovernmental agreement between the county of DuPage and Bloomingdale Township for Broker Road Stormwater Improvement Project, amount of $112,010. ARPA item.
Motion by member Zay, second by member Desart. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Zay.
Madam Chair, move on SMR 46022, accept an appropriation of pre-disaster mitigation grant, Illinois Emergency Management Agency, the amount of $1,237,614.
Motion by member Zay, second by member Garcia. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Thank you, member Zay.
Thank you, Madam Chair.
We move on to technology. Member Selman.
Thank you, Madam Chair. I move on TEP 312-22, a recommendation for the approval of a contract purchase order to Integrated Document Technologies for our software maintenance of imaging systems for various departments. Contract covers January 1st, 2023 through January 31st, 2024 for a total of $58,227.56, and this is sole source.
Motion by member Selman, second by member Desart. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Selman.
Thank you, Madam Chair. I move on TEP 313-22, a recommendation for the approval of a contract purchase order to IBM Corporations for our system server. This is from December 1st, 2022 through November 30th, 2023 for a total of $111,171.72. And this is also sole source.
Motion by member Selman, second by member Desart. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Thank you, member Selman. We move on to transportation. Member
Good
Pachowski.
morning, Madam Chair. I would move to approve DTR 0284B-17, amendment to a resolution for an intergovernmental agreement between the county of DuPage and the city of Wheaton for intersection improvements along Gary Avenue at Jewel Road to decrease the funding $19,460.23, resulting in an amended county cost of $18,115.01.
I have a motion by member Pachowski, a second by member Desart. Any discussion? All in favor? Opposed? The motion carries. Member Pachowski.
Thank you, Madam Chair. Move to approve DTR 0242A-21, amendment to a resolution issued to H&H Electric Company for mast arm replacement and traffic signal modification at various intersections within DuPage County to increase the funding $11,500, resulting in a county cost of $623,603.55.
Motion by member Pachowski, second by member Desart. Any discussion? All in favor? Opposed, the motion carries. Member Pachowski.
Thank you, Madam Chair. Move to approve DTP 01408-22, an amendment to a resolution issued to HW Lochner Inc. for professional structural engineering services for section 22 at Sting 05 EG to increase the funding $245,000, resulting in an amended contract of $595,000, an increase of 70%.
Motion by member Pachowski, second by member Desart, and I see member Renahan, you have a question?
Yeah, I did have a question. I mean, we're looking at a 70% increase. We just talked about a $29 million project over at the care center and how we're going to control costs and address that. I'm wondering, what is the difference here in terms of why are we up so much?
I think there was a lot of additional work for grading, but Chris can address that.
Yeah, thank you, Chris.
Figured out this time. So good morning, everyone. So on this particular item, we had HW Lochner on retainer to do structural engineering for various projects that might come around. Earlier this year, and we talked to Transportation Committee, IDOT had done some evaluations of a number of bridges and decreased the load rating on this particular bridge. Because it's over a railroad and there's so few crossings of railroads, we asked HW Lochner under their current contract to kind of evaluate how we can increase that loading. So they looked at alternatives and other things, and they came up with the only feasible solution is a complete replacement of the bridge. So given the work that they had done to date under their current various contract, it made sense, given the significance of this bridge, limited crossings, to continue to work with them, cancel all their build work orders, give them to somebody else, and instead of going out with a consultant selection, to continue to use them instead. The resulting lowering of the weight limit does impact our snow and ice operations. So we've had to make changes to our view of our fleet and our response in order to continue to go over the bridge in the interim until it can be replaced.
Thank you. Thank you, member Renahan. Any other questions? Okay, all those in favor?
Aye.
Opposed, the motion carries. Member Pachowski.
Thank you, Madam Chair. Move to approve DTR 0004B-20, amendment to a resolution for a local agency agreement between the County of DuPage and Illinois Department of Transportation for improvements to 75th Street from Lyman Avenue to Exner Williams Road, increase the county share of $310,000, resulting in an estimated final county cost of $1,340,960, an increase of 30.06%.
Motion by member Pachowski, second by member Desart. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Member Pachowski.
Move to approve DTR 0172B-22, amendment to a resolution issued to K5 Construction Corporation for the 2022 pavement maintenance South program to increase the funding amount of $100,000, resulting in amending contract amount of $4,797,308.59.
Motion by member Pachowski, second by member Garcia. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Member Pachowski.
Move to approve DTR 01738-22, amendment to a resolution issued to RW Dutton Company for the 22 pavement maintenance North program to increase the funding $225,000, resulting in a final county cost of $5,613,504, an increase of 4.18%.
Motion by member Pachowski, second by member Garcia. Any discussion? All in favor?
Aye.
Opposed, the motion carries. Member Pachowski.
Thank you, Madam Chair. Move to DTP 0155A-22, an amendment to a resolution to Patrick Engineering for professional phase 1 preliminary engineering and phase 2 design engineering services for improvements to the bridge carrying Geneva Road over the west branch of the DuPage River to increase the funding $162,454.55, resulting in an amended contract total of $694,370.58, an increase of 30.54%.
Motion by member Pachowski, second by member Desart. Any discussion? All in favor?
Aye.
Opposed, the motion carries. Member Pachowski.
Thank you, Madam Chair. Move to DTP 0242B-19, amendment to a resolution issued to Trans System Corporation for professional preliminary engineering services for improvements at Naperville Road at Illinois 38 to increase the funding $43,641.55, resulting in an amended contract total amount of $329,559.09, an increase of 15.26%.
Motion by member Pachowski, second by member Desart. Any discussion? All in favor?
Aye.
Opposed, the motion carries. Member Pachowski.
Thank you, Madam Chair. Move to approve DTR 0039A-22, amendment to a resolution to a local agency agreement between the County of DuPage and Illinois Department of Transportation to improvements to Hobson Road, 63rd Street from Woodward Drive to James Street to increase the county share of funding in the amount of $600,000, resulting in an estimated county cost of $900,000, an increase of 200%.
Motion by member Pachowski, second by member Desart. Any discussion? All in favor? Opposed? The motion carries. Member Pachowski.
Motion to approve an amendment to a recommendation of approval to amend ODT 00001A-06 DuPage County Highway Rights of Way Permit Fee Ordinance.
Motion by member Pachowski, second by member Garcia. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Pachowski.
Thank you, Madam Chair. Move to DTP 0300-22, recommendation for approval of contract STATE Inc. Testing LLC for professional materials testing, engineering services upon request of the Department of Transportation, $84,000, facilities maintenance, $8,000, stormwater, $8,000 for contract not to exceed $100,000.
Motion by member Pachowski, second by member Garcia. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Pachowski.
Thank you, Madam Chair. Move to approve DTP 0308-22, recommendation for the approval of contract to Huff and Huff Inc. to provide professional landscape design and engineering services for various county highway projects for a contract total amount not to exceed $100,000.
Motion by member Pachowski, second by member Garcia. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Pachowski.
And lastly, Madam Chair, I move to approve DTR 0461-22, a resolution for an agreement between the County of DuPage and Chicago Metropolitan Agency for Planning, CMAP, for safe streets and roads for all grant county costs, $60,000.
Motion by member Pachowski, second by member Desart. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Thank you, member Pachowski. We move on to finance resolutions. Member Krajewski.
Thank you, Madam Chair. Move on FIR 0469-22, recommendation for the approval of an intergovernmental agreement between the County of DuPage and the Veterans Assistance Commission.
Motion by member Krajewski, second by member Desart. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0471-22, resolution for additional appropriation for the ARPA fund for local food pantry agencies, $1 million.
Motion by member Krajewski, second by member Desart. Any discussion?
Just
All
thank
in favor?
Mary for all the work she did on getting this.
Yes,
get these-
Mary, thank
get
you
these-
so much for all your work
get
on
these
this.
checks sent out right away to these pantries. That'll be great.
Yes, yes. All in favor? Did we do this already?
Aye.
Opposed? Motion carries. Thank you. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0472-22, resolution approving a grant agreement with the local food pantry agencies for the use of the ARPA funds of $1 million.
Motion by member Krajewski, second by member Garcia. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0464-22, resolution authorizing to transfer and appropriate $398,680 in additional funds from the general fund to the stormwater management fund for the Winfield Creek project, which is coming out of our 2022 surplus.
Motion by member Krajewski, second by member Garcia. Any discussion? All in favor? Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0465-22, resolution for the authorization of transfer and appropriation of $393,800 in additional funds from the general fund to the county infrastructure fund for the 421 building solar.
Motion by member Krajewski, second by member Zay. Any discussion? All in favor? Member Garcia?
Just gonna say, yay, we're getting solar arrays. That's all.
Yes. All in favor?
Aye.
Any opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0468-22, which is resolution authorization to transfer and appropriate $6 million in additional funds from the general fund to the county infrastructure fund for the replacement of our ERP system coming out of the 2022 surplus.
I have a motion by member Krajewski and a second by member Desart. I did have some questions on this from some of the committee members. So Jeff, or would someone just want to come up and just explain this a little more detail with the 6 million?
Okay, so on the ERP system, we were notified about a year and a half ago that our current vendor, Infor, will no longer be supporting our current version. So they've asked us to upgrade to the cloud, and there was a cost to doing that. So at this time, our current version will expire. And we have also started to do RFPs for a new financial software system and human resources system. So that's in the works. What this appropriation is just taking the $6 million and setting it aside into an infrastructure fund in case we need, well, we will need this money down the road. What that cost will entail for a new accounting and financial system and HR system, we're not sure. But you know, I'm sure we're going to need more eventually than just $6 million. So this is just kind of a down payment for that. We're going to evaluate everything to see what kind of costs come in, all different types of vendors, and whether it makes sense to stay with the current system or go to a new vendor entirely.
Okay, thank you. And member to start, you had a question?
I did, thanks. So if you don't know how much it's gonna cost, how can you ask for 6 million? Where did that number come from?
It actually came from Infor to do the upgrade alone for HR and our financials was right around that amount. But we're not paying them by any means. We are just setting this
Putting it
aside.
aside,
Yeah,
right, I get that.
yeah.
And my other question is, now, once D, E, and F are approved, how much do we have left in our surplus budget? What has
So
not been spent?
once D, E, and F are approved,
Right,
our remaining surplus will have spent 26.1 million out of the 40. So that leaves us with approximately $13.9 million remaining in the projected 22 surplus.
thank you, Jeff.
And I have breaking news.
Oh.
We just received our sales tax allotment in for November, and it was 11.3 million. It's substantially over budget again. So something would really have to fall off the rails to not hit that $40 million in the general fund.
And how much over budget was the 11.3 million?
Well, we're projecting overall will be 40 million, but now if everything's approved, we'll have $13.9 million left in that surplus.
But you just said that November was, the take was 11.3, so what's the overage?
I didn't look at what we had specifically budgeted for November sales tax. My guess it's going to be about $1.5 million over.
That's it. Thank you so much.
Thank you, member to start, member Garcia, and then member Zay.
Yeah, thank you so much, Jeff. Just so I'm clear on this, so we have 13.9 million in surplus, correct now? That does not include the 11.3 you think we're gonna be over, correct?
It does not. We had to do some refiguring, if you will, for the projects that we had proposed about a month ago. You remember that large presentation that we did on all of the countywide projects. I think what was in there was the $10 million for the garage facility. We kind of had to pull back on that. So that now is part of the surplus. Anything that we don't spend goes into our general fund reserves.
Okay.
So this will play out until about February as we start to close our general ledger and our books for 2022. We still have some time to figure out, you know, what we want to do, you know, with that money and if we want to do anything with it.
Okay, and then going back to the ERP system, I know that I think it says there was sunsetting like in 2026.
2026.
Right.
Yeah.
I know I went to technology this morning and they said it's going to take a couple of years even to get any of this going. So this is a good reason to get this appropriated now, in my opinion, because then they can start working on this now since it's going to take a couple of years. So.
Right, and we're in the RFP process right now.
Right.
So November, we should have the HR piece out. February, the financials out.
All right, perfect. Thank you so much.
Okay, I have member Zay, member to start, and then member Kajewski. So member Zay, go ahead, please.
Thank you, Madam Chair. You know, I totally disagree on this. I don't know why we're taking $6 million on a project that's going to take several years and tying the hands of another board in the future on doing this. I mean, if we don't put this in the infrastructure fund, it's just going to go into reserves.
Right.
And if the board in the future knows that we're going to have to replace the ERP, which is several years away, they have to plan for that. I mean, if we put it in the infrastructure fund, we're going to be transferring that money next year anyways, because we're not going to spend it next year. Right?
No, it will remain in the infrastructure fund, the capital improvement fund for technology until it's spent. That this is like a down payment. So we're not spending it by any means. We're just setting it aside.
A down payment on something we have no idea what the cost is going to be.
Well, we kind of have a
on an ERP
projection.
system that we just bought not that long ago as compared to how we buy technology around here. That, all of a sudden now we have to replace it. I mean, I would just let this go. And I mean, why are we, get us more definite figures before we tie up $6 million, just put it in the general fund reserves. We know in the future boards, they know down the road, this is going to have to be replaced. Not next year, the following year, probably the following year after that, the way we implement technology. It's going to take several years to do this. I mean, to tie it up now, and it just doesn't make a lot of sense to me, especially when we still have $100 million sitting in our reserves. I mean, that money could be used for more needy things that's around here that's more current than our ERP system.
It's an option.
Okay, thank you.
Thank you, Member Zay. Member Dessert.
Thank you. So I just want to make sure I understand. We've got $13.9 million left in surplus, plus 1.5 overage for November, maybe 1.5 overage for December. So our surplus is now at 16.9.
No, remember when we proposed the 40 million, it was a projection. So we're still projecting to be on pace with a $40 million surplus because nothing has changed since then. So we're taking that 40 million projected, subtracting everything that we've used out of the surplus and coming up with 13.9.
Okay, so
It
the
could be
other
less.
was already in the projection.
It could be less or it could be more by February.
Okay.
We'll have hard numbers by then, but
So another question, I get it now, thank you. If we take this $6 million for the ERP system and put it in a technology fund or an infrastructure fund or whatever you want to call it, and we don't use it for, I don't know, you were saying 2 or 3 years, how much interest does $6 million make in 2 or 3 years?
it wouldn't be a windfall of interest. It'd probably be in the 5-figure range. Interest rates are going up. I know the treasurer's office has has some new vendors in there that manages county money. You could be looking at an interest rate for this of anywhere to 4 to 6%, I believe, on that 6 million. So
Instead of blowing the money now on something else and just putting it in an infrastructure fund, we could be making some money on it, right?
well, it'll make money no matter what. If it sits in the general fund, it'll earn the, yeah.
Thank you.
Yeah, and keep in mind that setting this money aside or putting it in these funds for future years takes pressure off the general fund and allows us to pay for our increases that we gave our employees and for our insurance that we've helped that we didn't pass that cost on to our employees. So we're this is like a rainy day fund in a way, and it's allowing us to save and take that pressure off our general fund. So to me, this is really good budgeting and really good financial decisions, but it's up to the rest of the board how they want to, move forward with that. Member Krajewski?
Madam Chair.
Oh, I'm sorry.
No problem. So I just wanted to add that some of that money will be used. So an ERP system takes anywhere from 12 to 24 months to implement, but you have to pay for the implementation services. And our goal is to get ahead of it and start next year, implementing a new system or working with Infor to upgrade. Their upgrade to the cloud is actually a new application. So they're forcing us to and that's why members that we have to do this, they're forcing us to go to a new system. So instead of us just going with that new system, we should probably do our due diligence via RFPs to find the right solution. And it's going to cost probably close to the same amount as our projection. So we also looked at the numbers across the board, may be $1 million or $2 million more for a new system versus upgrading a system that isn't fully meeting all of our expectations.
Member Zay.
Why isn't fully meeting our expectations? We spent a lot of money on that. Why didn't we fully expend that money so it was doing what we originally spent the money for?
I wish I could answer that. I couldn't answer that.
Well, fully not meeting our expectations is specific to HR and payroll. There just has been numerous problems with timekeeping system. It's hard to explain, but there's a list of them that we think we could do better with a new system. The the chief human resource officer has not been happy with that software for quite some time. There's just things that don't work like we had anticipated it to back when we bought it. We've tried, numerous different vendors to help us with these issues, but we just haven't been able to get what we need out of the system.
So payroll is a major problem.
Payroll is a major
Have
problem.
we ever thought of outsourcing it to one of the 20 companies that does payroll?
We're talking about that internally right now.
Yeah, and it's also my understanding that this software is not really government compatible. I also think it's contributing to the time and effort that has to go into our agendas as well. It's been very difficult for our staff with these agendas. So really, from what I understand, the system just has not been compatible with government agencies, and we really need to upgrade and get something that is more user-friendly. So Member Kajewski?
Yes, it was $9,893,150 what they budgeted, so 11.3, almost 1.5, 1.4. But to get to your point, I'll disagree with that. I mean, governments use this. I mean, I think when Kinsey came in and did the analysis, we didn't even implement some of the modules. That like procurement, we didn't implement the modules. People didn't understand how to use the system. They lacked the training, I think it was found. If people got the training and then knew how to use it, it would have been much more efficient. So that was the biggest problem. And then with regards to payroll, Infor is used by many governments around the country. The payroll issue, 99%, and I think I talked to you anything about where you were at, the payroll is done by the finance department, not HR. So we keep looking, well, let's outsource. Let's put it where everybody else puts it, underneath finance. That's where payroll belongs. And that's where it's been. And I guarantee, Jeff, you have it underneath you. You will have the people, you'll have them trained, and they'll be able to use the payroll system. I mean, it's not hard.
If we would go that route where finance would assume payroll, we think the best way to implement that change is through either upgrading Infor to the new version or finding a new HR system.
Absolutely. Well, absolutely.
Right.
Absolutely.
To take it over now.
No, I would think that's the planning you want to do.
Yeah.
For going into the new ERP system, whether you're going to upgrade it Infor and use them or go out to a new system, is move payroll where it should be, where it is in almost every other government agency. It's underneath the finance.
Right.
And it'll run much more efficiently and we won't have the problems. And then we need to make sure when we implement the either new system upgrade is the people lack the training. They don't know how to use the system. The ones that were here, I think that used it, they left. And I mean, I was shocked, a year and a half ago when Chairwoman, I met with you guys and we were looking at like procurement didn't even implement the module.
Well,
and you guys were doing a lot of stuff by hand, like even the fixed assets.
Well, to be fair, it's a very difficult system to navigate. It's not intuitive.
No, I understand that, but you still, if you can use it and learn how to use it, it makes it much more efficient. You guys are doing a lot by hand, the fixed asset stuff.
We've implemented that.
I know you've implemented now, but we didn't have it before you got here and everything was done by hand. It was a lot of time that was wasted. It's, you implemented it and it's using it. And are you saving a lot more time with the fixed asset side?
That remains to be seen.
Okay.
When we get new staff in, it takes them a long time to figure out how to use that system because it's not point and click. It's not, the best word I can use is intuitive.
Well, either way, you give them the training to figure out how to do. That's the one thing I think I heard lack from our staff members. They didn't get trained. They don't know how to use the system.
Now, as far as financials are concerned, I could stay with Infor and go to the new cloud. But because of the costs, I think we have to send it out to RFP.
Oh, absolutely.
I don't have the issues like HR has with that software. So I'd be happy to go to the cloud, save as much money as we can on our financials and then focus on HR. But when you talk about an upgrade for, financials would probably be anywhere from $2 to $4 million. We have to RFP it.
And then from a reporting standpoint, we put the 6 million into the county infrastructure fund. Well, if we don't do that and we leave it in the general fund, 3 years from now, when we go to implement the system and we spend 6 million, I assume in that year, because that 6 million will come out of the reserves then in the general fund.
You would have to.
Right. It'll come out of the reserves, but that'll be a deficit general fund spent that year.
That is correct, yeah.
So I mean, from an optic standpoint, it'll look like we won't have a balanced budget. We'll have a $6 million deficit, where if it's in that infrastructure fund,
Right.
then that's out of the general fund. At least it won't make it look like this future board, whoever's here 3 years from now, had a negative spend in the general fund. I mean, that's basically just funding future, and we can always move it 6 years or 3 years from now out of the county infrastructure back somewhere else.
Right.
I mean,
Yeah. no,
any
that-
future board can do that.
Right.
Thank you.
Great. Thank you, Member Kajewski. Member Selman.
Yeah, I just wanted to take offense, frankly, with some of the characterizations of our tech team. The idea that we, I don't know, don't implement, don't spend money properly is just couldn't simply be farther from the truth. Just today, Anthony gave us an incredible update talking about how the progress we've made to transition our website to a .gov, our Tyler tax system, which is replacing a frank dinosaur and allowing us to properly track our properties. We've increased our cybersecurity over 10 times, which has led to a savings in our insurance rate. And not to mention, our tech staff is the reason we were able to stay open during the pandemic when other counties closed. So I certainly don't have any issues with people having questions. If you're going, please do not insult our very hardworking staff on the tech team. Thank you.
Thank you, Member Selman. Okay, any further discussion? Jeff, thank you so much for coming up because I did have questions on this, so I appreciate your time. Are there any other questions on this item? Okay, all those in favor? Opposed? The motion carries. Member Krajewski? G, we're on item G.
Let's see, move on FIR 0466 resolution compensation structure wage adjustment guidelines.
Motion by Member Krajewski, second by Member Garcia. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. Move on FIR 0467-22 authorization to transfer funds from the general fund to the Veterans Assistance Commission, not to exceed $690,285.
Motion by Member Krajewski, second by Member Desart. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. Move on FIO 0069-22 annual appropriation ordinance for the Veterans Assistance Commission for the County of DuPage.
Motion by Member Krajewski, second by Member Desart. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Thank you. And we move on to item number 10, informational. Member Krajewski.
Thank you, Madam Chair. Move on to receive and place on file informational items, A, payment of claims, B, appointments, and C, grant proposal notifications.
We have a motion and by Member Krajewski, a second by Member Garcia to receive and place on file items A, B, and C under informational. Any discussion? All in favor?
Aye.
Any opposed? The motion carries. Thank you, Member Krajewski. Informational item. Can I have a motion on DTR 0306-822 vehicle replacement purchase order for service mailroom, $38,187.54. Motion by Member Ozark, second by Member Selman. Any discussion? All in favor? Any opposed? Okay, the motion carries. We move on to item 12, discussion. We have a funding request for pads for winter housing assistance, and I believe we have Mary Keating on the line. Just to give a back.
I'm here. Yeah, I'm here. Thank you. I apologize for the delay.
Oh, no.
Yes, PADS is seeking assistance from the county. As you know, the county has assisted PADS with purchase of a prior hotel to provide their interim housing center. The great news is that has tremendously increased PADS capacity to serve particularly families who are experiencing homelessness. However, as soon as, shortly after the interim housing center opened, they were at capacity. They have seen an increase in the number of families and individuals who are seeking shelter. So PADS is concerned about the individuals who are on their current waiting list as we get into the colder months. PADS has a street outreach team that currently works with folks who are experiencing homelessness as they seek to get connected to services. So what PADS is requesting is assistance from the county in giving those folks some short-term shelter stays, hotel stays over the winter months as they are on the PADS waiting list to get into the interim housing center. They specifically have stated to me that these hotel rooms would be outside of the current service area of the current community where the interim housing center is. So they would not be putting any additional requirements or burdens on that municipality. I think if there's any other background information, I'd be happy to answer it.
Thank you, Mary. Yeah, and last Wednesday, Member Garcia and I attended the PADS breakfast, and we talked with April, and she did express concerns that they had about 50 to 60 families that weren't going to have shelter for December, January, and February. I know it's been a priority of this board. I commend everyone for their commitment to providing for the most vulnerable in our community. And this program, we heard from one lady speak Wednesday morning about her success story going into the interim shelter and now living in an apartment. So it's been, a great resource for our community. That was just a little bit of background, but if anybody has any questions, Member Chowski, Member Desart, Member Krajewski.
That 250,000, is that for 2 months, 3 months? What's the time frame that covers?
3 months.
3 months. Okay, thank you.
Member Desart?
Yeah, Mary, what does it mean to be out of the area? Can you describe that? What does out of the area mean? Does that mean out of DuPage County?
I'm not understanding the context of the question. Is there something in the letter that says out of the area?
No, something that you just said.
Oh, okay. So the interim housing center is located in Downers Grove.
Okay.
And what PADS has indicated is that they would not be seeking additional hotel rooms in Downers Grove. They would be in other communities in DuPage County.
Great, thank you, Member Desart. Member Krajewski.
Yeah, several things. One is, if we want to help out PADS, but I think we need to have a broader discussion and maybe put it in a committee or something, maybe HHS, to be able to look at this, because PADS went into Downers Grove, the Red Roof Inn. Kids are going to the grade schools there, specifically Bel Air, the smallest of the 13 schools. They've already incurred about $250,000. I sent that stuff to Mary. But they also, I think we can bring some parties together, like our OE, the Village of Downers Grove, and the school districts and us to help with the issues. PADS also wants to provide tutoring for all these students that are in that center. And, the villages allegedly can't allow the zoning. They got a hotel, like all the kids living there, and they can't provide tutoring in the hotel. Their zoning prohibits it. Although I talked to the village manager yesterday. They did say that there's a way around that, or there's probably a variance or something you could get for the zoning. But in the meantime, I know April said that Mary forwarded me the stuff that they've gone out to look for tutoring spots. They had a place near there that kids could walk, except for allegedly the landlord said we don't want those type of people there, and supposedly our state's attorney's looking into that. But they're looking to contract somewhere else to provide tutoring, and then have bus service or transportation service to take these kids to tutoring when they should be able to do it in their facility. I think we need to get the Village of Downers Grove. They said they participate in it, but there is variances and procedures they can do. From common sense standpoint, they should be able to provide the tutoring. Darlene Rossetti, she was going to try to get here today, but she texted me that she couldn't make it this morning, but she said, District 58 has some very big concerns. Like they said, they've spent a lot of money already for Bel Air, but she said they need more clerical staff to process students, need more social workers to assist. She said she can assist her office in getting a grant, but to get, if we can provide them with some money, they could get a grant that can help not only that specific area, but other parts of DuPage County with PADS. And so I think they have the ability to go offer grant funds, but also have them work directly for the ROE. And then, if we provide maybe a little bit of money for their office, they can help not only there with some counseling for these people, but I think there's a bigger thing we can do for everybody involved. But we have to drive it at the county. But I think getting all those parties together, again, I think Downers Grove can help with the zoning changes, but they should be able to do tutoring in that center. I mean, that makes no sense. So they should be able to work around, but now PADS is going to go incur some money and sign a lease somewhere and then transport people there when they can do it right in their facility. And I think, I know District 58 has some issues with teacher union contracts and providing teachers. out there, but if it can come out of the ROE office, then they can get around that. So again, I just think maybe we get everybody together. I have no problem with $250,000 to help them through the winter, but I think we can do a lot more, but I think we have to get together and get all the parties together to do that.
Yeah, and I don't necessarily disagree, but there are schools throughout DuPage County that have homeless kids as well, and some of them have many more than the Downers Grove School District. So and it really is the school district responsibility. There's that McKinney, let me get the name, Vento law, that this is really the school's responsibility, and they really need to fund this through state and federal dollars. I mean, and they have to do this. And with the tutoring, it's not in PAD's mission or charter to provide tutoring. I think a thing that they would like to do, but I think again, it's going to have to be worked out. And I think these are all valid points, but something
School's
that.
not going to do the tutoring either. That means nobody will do the tutoring unless we get everybody together.
Well, right. And I think it's a good discussion for another, for another day, but yes. But thank you, Member Kajus. So I have Member Garcia and Member Renahan. Member Garcia.
Yeah, thank you. And Member Krajewski, you do bring up some valid points. This is to keep people warm for the winter, this exact item. And so I think we have to keep in mind that is the main goal of this, is we don't want people as the DuPage County Board to be outside freezing during the winter months. That's something we heard about. They're very fearful of PADS. In terms of the tutoring, I think that's something that I'd never heard of that zoning, quite honestly. If they get a one-on-one tutor, I don't know exactly what you're talking about in terms of zoning. So I guess I'd be interested to see that. So that definitely we could get some kind of discussion on that. But we were at the breakfast, and there was a big shout out to the principals and the school districts of Downers Grove, because they said they're all working together really well. So I heard a whole different story at the breakfast the other morning. So, I just want to make sure that when we vote on this, we're making sure that we're taking care of at least 60 families to make sure that they stay warm this winter. Thank you.
Thank you, Member Garcia. Member Renahan.
Thank you, Madam Chair. And I'm so glad this is coming before us. And I wish the PADS maybe had even reached out earlier, looking at it's going to be colder. We know with the CARES Act, it was one of the first things that we were privileged to do as this board was to take care of the people who would be experiencing homelessness. And we know that's only continued as eviction has increased. As per Member Krajewski's request, I mean, it's sort of interesting because I did take a look yesterday at the ROE website. And it said, I'm just going to read, this is one of their top things that they said, the McKinney-Vento homeless liaison, which is required by law, by the way, for us to have that, served 1,932 homeless students in DuPage County and partnered with the interim housing director to provide an educational liaison and a dedicated homework space at the new 130 unit emergency housing center in Downers Grove. So maybe we're missing a piece of information here, because the ROE is reporting that they are helping out. I know that they're not required to provide a homework space or whatever. If you look at the McKinney-Vento, it's an opportunity that you can use because there is state funding, there is federal funding available. I think it's about $580 per homeless student at this point. So I think the ROE really needs to take the lead here. Schools are not our jurisdiction. We know this. We've been through it. We talked about masks how many times, but that was not something that we would have the ability to do anything with. So willing to have the conversation, but I think there are other stakeholders that really need to spearhead this.
Thank you, Member Renahan. Member Zay.
Thank you, Madam Chair. I mean, great discussions. Since COVID, I don't think have had an update from DuPage PADS. Obviously, their model has changed drastically from a lot of us who used to volunteer at churches and everything like that. It would be nice to get an update to see where their model is going and what they're going to do in the future, because it'd be nice to know if this 250 is just tip of the iceberg. How's their fundraising going? Is 250 going to cover it for everybody, or are they putting additional money in? And what do they see down the road? I mean, how are they going to do that? So
thank you.
We have somebody here today.
Yeah, I have Karen.
It'd be nice to get a full update with, not like Karen Ayala's update, but something in between,
Sure, we could, and that's a great idea. And I'm sure April will be happy to come in and speak before the board, maybe get her before the end of the year. And also I have Karen here from PADS. And did you want to just give us a little brief update on?
So our previous model for emergency housing was to partner with 3 different congregational sites a night. Each site served up to 50 people. So we had about a capacity of 150 a night. Sometimes in the winter when it was really warm or really cold, we would get some temporary variances for capacity from the local fire department so that we could increase when needed. What we did over COVID is we did purchase the IHC, which is the former Red Roof Inn. We now have a capacity of, or a bed count of 300 a night about. And the biggest increase has been with having kids come with their households. We are finding that that increase is because families who are previously maybe had gone from family member to family member or friend to friend and weren't out there welcome now have a new place to go. Single parents with children who did not want to bring their children to an emergency site where they're in a congregate room with 50 other people. Now they have a space of their own with a door in their own bathroom and feel a little more safe. Or folks that were in a domestic violence situation that now have a place to go to. So our largest increase has been with the children count in our IHC. So with that, with our waiting list, those folks are ones who are waiting for, it's about, 2-week period while they come to us first for services until there's an opening at the IHC by somebody who has gone on to a stable housing situation.
What this covers is temporary housing at hotels, other parts of the county. That's what it basically does, or?
This would house those folks who are on that waiting list for usually 2 weeks until they can get into the IHC, just so they're not outside during inclement weather.
What's the average stay?
It depends. As soon as you get to a household of 4 or more, it's much longer because of the availability of apartment units that are 3 or more bedrooms.
Is this increase been steadily rising, as you're saying, or is it pretty steady when it starts getting colder?
It does get a little longer when it's colder because people are more likely to come to us where they may have been okay staying in their car or wherever else they were. But when it gets too cold there, we do find an influx of folks.
Is 250 will cover the entire program, or you're getting other outside funds?
We will put in any of our own that are needed as well, but this would just be for the hotel stays for those 3 months. Yeah. And then only what needed.
Thank you, Member Zay. I have Member Desart and then Member Eckhoff.
Thank you. Member Krajewski brings up some excellent challenges and ways in which to solve those challenges. But, the county, as you know, we've got transportation, stormwater to do and community services. And I just think that keeping 50 to 60 families warm in the winter is definitely under our umbrella. The tutoring and it's the homeless students not under our umbrella. So what is our bailiwick is keeping 50 to 60 families warm. And I say, let's do it.
Thank you, Member Desart. Member Eckhoff.
Well, I'm glad you were able to buy the Red Roof Inn, and the unfortunate thing, I guess, is it got filled up right away. But what's the need? Do you need another Red Roof Inn, or how many people are waiting to get in?
Right now, our current number of folks that are working with our street outreach is a little over 50. We have an indication of about 40 of them that are wanting the services. Not everybody who comes to us for street outreach wants to enter into the emergency shelter system. That's just right away.
Yeah.
But we're right now at about 40, but it will increase as it gets colder.
And are all the people that are in there and all the people that you hope to service with this grant money from DuPage County?
Yes, it's our priority, is the DuPage County.
Is there a requirement that they be from DuPage County, or so often it seems like DuPage County or other governmental agencies provide a service that nobody else is providing, and all of a sudden you get people who aren't part of that geographic area coming in to use it. I want to make sure that it's really used just for, unless there's other openings, it's just used for DuPage County.
Right, we have not exhausted our wait list of DuPage County with our last known zip is DuPage County on our waiting list. So we have not dipped into outside of area. When we do get somebody that came to us from outside the area, we first work to help them get back to the area. We've had people come to us who were trying to get back to, would have somewhere to stay if they could get back
And if
to
that doesn't work, you send Cook County a bill.
wherever, their last known address was. Yeah.
Thank you.
Okay, thank you. Member Krajewski. Thank you, Member
Yeah,
Eckhoff.
well, I mean, I guess
Thank
it's some of the stuff like the tutoring's outside of our purview and you guys are starting a tutoring program, but you're gonna be using resources for that. I mean, I think April sent Liz and I emailed about you wanted to do it this fall, but you're gonna start this thing in the spring, so you're gonna incur a bunch of costs that could be used for, if the mission is just to provide homeless shelters, it could be used for that. So, I mean,
So-
instead of tutoring, you could be using that money for the tutoring to put more people in shelters. I
Some
mean,
of the
I think
funding
we
does
want to
come-
do all of it, but I'm just saying that, you know, we're giving you money now to do that, but then you're starting a tutoring program.
Right, but some of those funds come from restricted grant applications, whether private or governmental. So we have to use them for the purpose of the grant.
I'll send you the zoning stuff that at least April sent to us, that what the village said, and I talked to the village manager, but they don't allow it based on, you're probably an expert in that, but again, you know, we could save you money by just getting the village to allow you to do that, help with the zoning. It doesn't cost us anything, but I think we can help work with changes. You don't have to go rent somewhere down the street and provide transportation. Do it right in your facility seems to be the best way to do it.
Thank you, Member Kajewski. Member Zay.
Madam Chair, are you gonna bring this back in 2 weeks then? Is that your plan?
What I'd like to do is, what I'd like to do is get consensus from the committee that we would like to provide this 250,000 to pads so that they can house these families over the winter. And then we can add to our discussion, you know, the school, the impact on the school and how what the best route is to help, you know, with that. Does that sound okay with you, members? Okay, great. So if there's no other questions, can I get consensus on, you know, does the board feel that we want to move forward with giving the 250 have it on our next agenda? Okay, great. So we do have consensus to move this forward to finance in 2 weeks. So thank you, Karen. Thank you for being here and thank you for your time and thank you to the committee. Under old business, we have our proposed budget changes for 2023. Does anyone have any questions on those budget changes? Okay, could you?
I mean,
Yeah.
you can still change.
Yeah,
them on the
absolutely.
floor.
This is just discussion if we wanted. to
It's
talk
always
about
fun for staff. They always get a little nervous, so it's.
Yeah, so I see Member Selman, go ahead.
Yeah, if you just kind of clarify what we're discussing, because last finance, we passed this out of committee here. So are you looking for changes?
So
what are you
if
looking
you
for us to
look
discuss?
on, the county board agenda, there's an item, and it has all of the budget changes. A lot of it is for the VAC, where, you know, they're going into their own entity now. So we have to.
Was
make-
that in this packet?
Yeah, it was in the.
It was in both? Okay, I must have just scrolled past, sorry.
That's okay.
So,
Go ahead. Nick.
Jeff can go a lot more in depth, but typically, as Member Zay said, the changes are done on the 22nd on the floor, but because we added a whole new budget with a VAC, you know, unfortunately, a member would have to read for about 30 minutes. And
It's
so
the
we-
legal changes that
we
Illinois
figured-
did,
we
right? It's
figured
not our.
It's actually more transparent because we're putting it in a spreadsheet now in the packet. And if it's accepted concurrence in county board, we will automatically finance, will update it. So it's on what's on the website. So on the 22nd, that will be the updated budget you're voting on. There still will be changes most likely on the 22nd, but not nearly the magnitude and the number that we're talking about now with adding a whole new budget.
Okay, so you're just looking for us to say, yep, changes look good.
Yeah, and if you had any,
Okay.
questions or concerns, you know, sometimes we have a little bit extra time in finance. So
Mm-hmm.
it's nice to discuss those so that we can, you know, get through county board as well. So,
Thank you.
Thank you, Member Selman. Member Desart?
So I do have a question. For example, what is transfer out of county infrastructure for $13,572,000? It's for the spa.
Those are items that we had proposed to fund in the 2023 budget, such as vehicles.
Then why are vehicles listed separately on the next page?
That has to do with timing of when we can purchase those vehicles.
I understand because of supply chain issues,
Supply
right?
chain.
So why is, okay, so help me understand. You're saying it's vehicles, but the vehicles are listed separately. So what is transfer out county infrastructure?
The specifics of that was vehicles and right now, was the ERP system
Oh,
mainly.
Okay,
Yeah.
the ERP system
Parking
is
deck.
6 million
Right,
and this is for 13 million,
Right,
13 and a
there's-
half million.
yeah, 6 million, and then the majority of that would make up the vehicles. I could get a list before the meeting, but there's some other.
yeah, the parking deck and the new ERP
Yeah,
system.
right, that's.
Parking deck is on here too. How much
Yeah.
was that?
The parking deck was, what was the estimate for the parking deck? We have to get that
So-
parking deck done.
So the 2023 budget that you were voting on originally had 13 million in it. In order to balance all these changes, that was where the money was taken from, was the infrastructure. And that's where you see the reduction. The 2023 budget, the vast majority of that was parking deck and ERP. Parking deck is estimated, and this is both parking decks rehab, is estimated between 13 and 18 million.
Okay, then this would be low at 15 million.
It absolutely is. I mean, and the parking deck is a multi-year project. That's a multi-year project. There is no way, and we can only do parts of the parking deck at a time in order to keep them functioning. So that's multi-years.
Okay.
I mean, this has been rehab that's been needed for years, but ultimately, can we push off the parking deck a year, 2 years? Yeah, we can, but every year we push it off, it costs a little bit more. But it's kind of the parking deck, the infrastructure was our balancing point in the 23 budget. And so that's where all of these changes are coming from.
Thank you. I just thought that, we've been talking about the various department budgets for months. And then we just get a flimsy, 1.5 sheet thing of a whole bunch of stuff that you want to change. Like, for example, why the paratransit program, which I think is wonderful, but we're asking for another $750,000 for that. Why wasn't that in the original budgets that we got, for example?
So keep in mind, the paratransit, just so you're looking, the finance approved, that first column.
Right.
You've already approved that in your budget.
Right.
That's what's in there. The changes on the next one are the adjustments. So on that one, you are only reducing it by 20,000. And the reason it's being reduced, it's not being reduced, it's being moved to the family center.
Oh, gotcha.
So all of this are clean. I mean, every time that
Right.
when we approve the budget in July and August, all the departments have little changes and instead of us doing it on the floor, we just put them all in here.
Gotcha. All right. Thanks so much. Appreciate it.
Hey, thank you, Member Dessart. Any other discussion? Okay, seeing none. Thank you, Nick. Thank you, Jeff. I am advised we do have executive session. So pursuant to Open Meetings Act 5 ILCS 120/2C8, security procedures, school building safety and security, and the use of personnel and equipment to respond to a threatened or responsible potential danger to safety of employees, students, staff, the public, or public property. Do I have a motion to go into executive session? Motion by Member Sullivan, second by Member Rutledge. Favor? Okay, opposed? Okay, we're going to adjourn into executive session.